enter the room.
Hello, I'm Dr. I'm one of the junior doctors in the emergency department. Am I speaking to Alex Jones?
Yes, correct. I'm Alex.
Okay, and can you confirm your daughter's name for me, please?
What is this regarding, doctor? Why are you calling exactly?
Um, well, I'll explain in a bit. I just need to confirm some information, if that's okay.
Yeah, I guess. Yeah, my daughter's name is Haley.
Okay, can you confirm her age for me, please?
She's 4 years old.
Okay, well, you brought your daughter 2 days ago because she has ingested something and she had an X-ray done. Is that right?
Yes, that's correct.
Yes. Well, um, the X-ray was reported as normal, and then we told you that you can go home. Is that right?
Yes, that's correct.
Yes. Well, unfortunately, the radiologist, who's an X-ray specialist, reviewed your daughter's X-ray, and we found out that she might have ingested something that looks like a button in her foot pipe.
What? What do you
Yes,
mean?
I'm very sorry for that. Your daughter shouldn't have been discharged, but we would need you to bring your daughter back again to the hospital so that she can be managed.
What do you mean she shouldn't have been discharged? You think I'm just waiting around for your call just so that, you can just come and disrupt my life whenever? I have my work. I have to go to work right now. What do you mean I have to bring her in? I can't do that. How do you
Yes,
miss this in the first place?
yes, I understand. I understand you're quite upset, and anyone in your place would feel the same way. I'm really sorry for that. But where is your daughter right now? Is she in school or?
No, doctor, she is with me, but sorry doesn't cut it. I am a working mother. You can't just call and ask me to bring my daughter in. Is this even an emergency? Why are you calling? If you missed the button, that's your fault.
Yes, we're very sorry for this mistake that has been done. But we would need you to bring your daughter because if there's something that's in her foot pipe, it would need to be taken out so that it doesn't cause an injury or any harm to her.
That is something that you should have thought of when you discharged her. I mean, I brought her in, understanding that, this could be a serious problem. And the doctors at that time told me that it was all right for me to go home. So I did. And now you're calling me saying that it's an emergency?
Yes, yes, I totally understand. And we actually take these sort of mistakes very seriously in the hospital. I'm going to guide you, refer you on where you can make a complaint about it, and where we will make sure that this sort of mistake does not happen again in the future.
Yeah, I'm not very sure if you can make sure of anything. And yes, I am going to make a complaint. What did you say? You were a junior doctor? I want to talk to your senior.
Yes, when you do come to the hospital, I can have one of the seniors talk to you. But again, I would really like to apologize. But it's really important that you bring your daughter to the hospital so that we can start with her management.
All right, fine, I can do that tomorrow. And I will definitely be making a complaint.
Well, I think it would be better if you could bring her in today, so that there's no delay in getting her treatment and we can start, she can be seen immediately by the specialists.
Doctor, what do you mean immediately? I can't just drop everything. I am a single working mother. How do you expect me to just, leave everything and come to the hospital for something that you have done wrong?
Well, we can write you like a note to your employer if you can get a leave, if you, maybe that would help. What do you?
I mean, there's something that you should do. Writing a note is a start.
Okay, yes, we can definitely write a note to your employer that you would need to leave to bring your daughter to the hospital, or if there is anyone else that you know that can come with her or
No, there
instead.
is nobody. It's just me. And I have to drop everything to bring her into the hospital. That's just too much to ask.
Yeah,
And
I'm very sorry for that.
and you mentioned this is an emergency. What are the complications? What can happen to my child?
Well, having any object in her foot pipe, sometimes it can go to her stomach and then pass without any harm. But if it gets stuck there, it can irritate the foot pipe, and I'm afraid it can maybe cause some bleeding and, you know, like an infection.
So where is the button right now?
2 minutes
It's
remaining.
in her foot pipe.
It's in her foot pipe right now.
Yes, and you know, like having a button there might even like prevent her from eating properly or drinking. She might have symptoms like vomiting. So it is better that she comes to the hospital to get assessed.
But nothing has happened like that. I mean, she's eating and drinking fine.
Well, I'm glad to hear that she's doing well so far. Okay, but just to make sure,
Her in. Like, why are you saying this is an emergency?
well, because in the image it shows that it's still there and it didn't pass. Maybe it would have passed by now, but it's better that you bring her again to the hospital so that we can check.
I'm not very happy about this, doctor. I'm not at all happy about this. And I really want to make a complaint. This is not something that anybody should endure.
Yes, I understand, and you have the right to make a complaint. After you come to the hospital, we can discuss this again, and I can refer you to the patient advice and liaison service, where your feedback is very, very important to us, so that we can ensure this doesn't happen again.
I mean, yeah, that's the least you can do. And how would I even know what you people are doing to improve the situation that you've put me in?
Uh, we're going to carry out our investigation, and we'll talk to you about the updates and everything.
I have
So,
a
do you think you?
I have a son at home and he's just barely 10. How can I just leave him alone? Do you understand what kind of position you're putting me in? I have to leave work. I have to find somebody for my son.
Well, I can. There are some child sitters that you can contact.
Thank you so much. All right, good job, Dr. Mai. And yeah, I know Angry Patient is a very challenging station.
That's a very good answer.
Pretty much you for sure. Like, but good job, you were calm throughout, and you managed to, tell her all the important things. So I would say that was a great performance.
Oh, thank you.
All right, so let's go through the workbench, and this is the product that we have made for the PLAB2 for doctors to practice different kinds of scenarios and cases to understand how to actually go about approaching a case. So we'll just go through the case overview. So after reading the candidate information, this is a little bit of an overview that you understand what you need to do, right? So far you have an information that there is a 4-year-old child who came into the emergency after swallowing a button and an X-ray was done and it was reported normal and they were sent home without any intervention, right? So that's all the information that you have. Now you have to do some data gathering. That's one thing that I saw that you were lacking. So you didn't really know what the story was. You don't know how she swallowed the button, what happened when she came in, right? So those are things
Yes,
that
it's true.
you understand by asking the patient. So there is a story that you have in your mind, and you have to, you know, confirm it from the patient. So that's the whole point of data gathering, right? Before you break the news. So you have to do it in layers so that, once you do break the news, all hell will break loose. So you need to understand, you need to gather all the information. So you need to understand that there is a, foreign body stuck in the patient's esophagus. So what are the complications of that? There could be perforation, there could be, like you said, problems with breathlessness and, dysphagia. So those are the things that you have to confirm and understand that that patient is not having. So it's been 2 days since the X-ray has happened. You don't know whether it's passed. You don't know if the patient has any complications. So before even disclosing the news, you need to understand the current state, right? You need to
Yes.
understand and you need to understand the current state of the patient, before you disclose it, so that you're in a better position to, react to the mother, the anxious mother, right? So we have Dr. Rohit with us, and he will take you through the case step by step. So yeah.
Hi, Dr. Mai. That was a really good performance. You're very confident when you're speaking. That's really good. That's very, very important. Try to keep that up. And your interpersonal skills are also really good. The way you react empathetically, like whenever the patient shows some emotion, you acknowledge that. That's also very good. So I'll just take you through the scoring. So we have a checklist that we follow. So your data gathering is very bad. I'm sorry to say that, but technically the first. So even technically this point also you didn't cover fully. So first thing in any case, make sure you ask the full name and age, and if it's a telephone consultation, like this case was a telephone consultation, right? So you see in the question, you see that over the phone it says, and in the exam it will be a little easier because it will be an actual telephone consultation, so you'll understand. But whenever you realize that it's a telephone consultation, make sure you ask the address as well. That's also very important. And there's a couple of things that need to be asked when it's a telephone consultation. That is, if it's the right time to talk, and if this is a number that you can get back if the phone gets cut. So these are the things that need to be asked in every telephone consultation for sure, because it's a emergency, right? Like if suddenly it gets cut, you don't know what's going to happen, and like you don't know if they might be driving. The news that you're giving can emotionally disturb them, and they might get into an accident. So you always have to follow this telephone etiquette for sure. All right.
Okay. Can you repeat about the phone being cut?
Yeah, so I'll just tell you again. So first thing is name, full name, age, and address. These are the three things. And after that, is this the right time to talk? And if the phone gets cut, is this the number that we can get back to you at?
Okay.
All right. So these are the things that in any telephone consultation you should always ask.
Additionally, you should also ask that, if we can hear you clearly, because you're trying to establish a conversation. So you need to understand if the line is clear, right?
And if it's a video call, can you see me clearly? So this also you have to add.
So these are some things that you have to follow for a telephone consultation. Even before you start talking, you need to understand if this is a good situation to talk, if they're talking to the right person, and if you are able to, communicate with them well.
So these all come under interpersonal skills technically in the exam. So that is something that you have to definitely maintain. So it will take some time. It'll end up eating at least 1.5 minutes of your time, but you have to do that for sure. Because that's gonna net you at least one or 1.5 points itself. So never miss that. And after that, so first always confirm the reason for the call and current symptoms. So this is something that you missed as well. So you technically you missed the entire data gathering. So you directly went into the fact that you just directly said that, so you came in because she swallowed a button. Is that right? So instead of doing that, you try to ask them about the incident, what happened. So you should say, as you know, your daughter was brought in recently. Can you just tell me a bit about what you already know? so that then you can fill in the gaps on whatever she tells you, right? That way, it always you should always check the perception first. So I'll just show you the. So there's something called a spikes protocol. So this is usually used for breaking bad news, but it basically fits into all this. So in angry patients, there's two types. There's angry patients where they're angry from beginning. As soon as you enter, they're angry already. So that's a completely different scenario. But these are the cases where you give a news and then they'll become angry. It's similar to the breaking bad news where you give a news and then they'll become emotional, right? So you can treat it similar to the breaking bad news situation where you can easily follow the spikes protocol. So spikes stand for setting, perception, invitation, knowledge, emotions, and strategy and summary. Right? So setting is basically the same thing. Introduce yourself, confirm name, age, ask if it is a good time to talk, add first line of address, all this. And perception. Perception is where you have time to do your data gathering. So technically these stations you don't have enough, you don't have much time for data gathering. So you have to pick and choose what are the questions that need to be asked. So you can't go and ask all allergy history and things like that. So you have to make sure what are the important things that need to be asked. So here, first thing is what happened, what is the incident, like what happened in what exactly happened that you brought her to the hospital. Right?
So when you're actually starting with the perception, it's a very good thing to start with an open-ended question. Like, so from whatever the data that you have, you mentioned actually you went about it very, very tactfully, saying that I understand that she was brought in because she swallowed a button. Am I right? And then she's like, yeah, I'm right. And like, okay, can you please tell me a little bit about that? So then that means it's an open-ended question. So everything that she can tell you, she'll tell you in that time. So you actually save yourself from actually asking more questions. So open-ended questions, they are like a boon to you because that will actually encourage the patient to say whatever they have to in one go rather than you asking like very closed-ended question like did she swallow a button? How long back was that? So that will just be like a one line answer.
Yeah. So tell me more. So these three words are something that's gonna save you a lot of questions. Because make sure you, any case, like whatever type of case it is, try to incorporate this open-ended questions in that. So if they tell you a symptom, so immediately say, can you just tell me a bit more about this? Can you please elaborate what you mean?
And it's a very good thing that you use the information that you already have in the question. So you use the candidate information to start the conversation, saying that I understand that this much has happened according to my understanding from the question, but can you tell me more according to you what has happened, right? So they will pour themselves out. And then you can start investigating within that to understand the current situation. So that is your main thing. You need to understand the current situation. Given any case, you need to understand the current situation to move forward.
And after that,
Actually, got confused because it was written like I saw the patient 2 days ago, so I wasn't sure like if I already know the history, should I ask again?
But so basically, whenever you have that doubt, always think what you already know, right? So it's okay if you've seen the patient. It's always good to confirm, right? Rather than having a doubt of you don't know something, it's always better to ask again, even if she gets exasperated, saying that I think I already spoke to you before. So you say that I'm extremely sorry to put you in this position, but is it okay if you can tell me this one more time? I mean, it's just an apologetic sentence that you can say, but it actually puts you on an advantage of knowing more, right?
And the rule of thumb in PLAB 2 is never assume you know something unless it's specifically given in the STEM, that is in the candidate info or in the findings itself. If it's not given, you don't know it. Never assume anything and never make up information. That's a very bad habit. So that's something the examiners don't like at all.
And they're waiting for you to make that mistake, because if you do make up something, they'll catch you on that, the simulators, and they'll keep harping on that point, saying that why did you say that? Why did you say that? Why do you say this? Right? So then that puts you in a very bad situation. So don't assume. If you think there is something that's going on, ask, because that will put you, more at ease.
Okay.
Right? And the next important question in data gathering is how is she now? So anytime when you're going to deliver some news, always ask what is the current situation like how is she doing now? So that gives you more information about what you need to tell, like how you need to deliver the news, right? So always ask how is she now? Is she having any symptoms right now? And is she eating and drinking normally? So that's important, right? It's inside the food pipe, so you need to know if it has actually affected her already, right? So this is the basic data gathering that you have to do. And other than that, so the ones that you have missed are basically in instant history. How did she swallow the button? That's basically how did it happen. So I understand that that she was brought in for swallowing a button. Can you just tell me a bit more about it? Then she'll tell you what incident has happened, right? And current condition, how she is, and how is she eating and breathing normally.
So that's where I actually caught you, because you said it was an emergency, but I don't know what the emergency is. So I kept asking you, like, what is the emergency? And you told me afterwards that she could have breathlessness and all that. But if you had gathered that data, asking, is she all right? Is she having any symptoms like breathlessness? Has she vomited? Or is she able to eat food and water properly? Then I would have just said no. So then that question wouldn't have come up when I get mad. Because angry patients are definitely get mad. So you're giving them less chances to, give more, dialogues with, that emotion.
Okay. Was it actually an emergency though? Like, would she have to come
At this
immediately?
point, since you have made a mistake and you don't know where the button is, it is definitely an emergency. If you don't know something and if it can cause a bad complication, it's definitely assume the worst.
Yeah, and it could have been a
Even if the
battery.
patient is fine.
And it could be a button battery for all you know. And that is like a very life-threatening emergency, right? You
Yeah, it
have to
could
bring them
leak,
in. Yeah.
and it could cause like esophageal corrosion. Then that's really bad, right? Like there could be like so much of esophagus getting irritated. So definitely, if there is a likely scenario in whatever the situation you're in where the complication, look at the worst complication and go with it first.
Yeah.
Because you always have to rule out the worst complication that can happen, right? So that's one thing about PLAB too. If you have to be a safe doctor, whatever the symptom is, always rule out the worst complication. In this case, the symptom or the scenario is swallowing a button where you saw the button in the esophagus. So at this point, even though it was 2 days ago, you know that there is a button stuck in the esophagus. So your situation at this point is button stuck in the esophagus. You don't know whether it's passed. You don't know if she has any symptoms. So you go in with the situation where it's the worst. That's why you bring her in immediately so that we can see, assess, and see what the current situation is.
Yeah,
right?
that's another very good rule of thumb. Always assume the worst because that will help you rule out red flags in data gathering, and it'll also help you give a safety net in your management, right? So you always red flags are what? Which are basically what's the worst thing that can what's worst symptom, right? That's your red flag. So you can rule that out. And in data management, the very important point is safety netting. So we'll get to that, but that's one of the points that you can easily rule out by just assuming the worst possible scenario, right? And so these are the basic data gathering that you have to do. And after that, other data gathering that you should also do are basically past medical history, medication history, because these are all relevant for your current situation on what is going to happen to her, what we have to do first. For example, if the patient, if she has some bleeding disorder or things like that, you have to, it becomes even more of an emergency, right? That is something that you have to keep in mind as well. So that is something yes you should keep. And other than that, and family history, allergy history, these are the ones that you can either ask or you can skip. Just 1 second. Yeah. So these are the ones that you have to ask, but you can keep it for the end. If you have enough time, you can ask. But these two are things that you have to definitely ask again. So living situation, psychosocial history. Any case you have to always ask, but pediatric cases it's even more important that you ask these because it's a child. You don't know if the child's environment is okay because it's you're not always just treating the condition, you're treating the patient. So that means it's a holistic management where you have to see once they go back from the hospital, what is going to happen to them? Are they okay to live by themselves, or do they need additional support from the from the NHS? So that is something you have to keep in mind as well.
And in this scenario, you're actually understanding that the mother is a single mother. She has a lot of stress in life. She has work. She has to take care of another child, and then you're asking her another thing to do, and you're calling it an emergency. So you understand that this patient is in stress. So you kind of want to give her some help. You did say that we have some services where social services where they can come in and take care of your other child while you come and visit us in the hospital. You should offer that. Like you should try to, roll out the red carpet for them, because for you, it's way important to get that X-ray than what her problem is. So you have to somehow solve all of her problems so that she can be available to get the X-ray done. Because this is otherwise a medical legal case. You missed a button, and this could actually lead to the child, even dying. So that will actually be on the hospital, and you don't want to take that on. So you have to do everything in your power so that you can facilitate the mother to actually come to the hospital. So what? And then she said, I have work. I have to go to work. So you mentioned that there is. I could write you a note to tell your manager, your employer, that what the current situation is and why you need to come to the hospital. We'll try to arrange everything beforehand. As soon as you come, we'll try to make sure that everything happens immediately so that you won't waste much time. You can give her all these options. Try to argue with her saying that you need to come and do this first. And if anything that is bothering you, we'll try to take care of that from our end. Right?
Okay.
And the next part is in the spikes protocol. So perception is where you do all your data gathering, right? And then next one is invitation. So invitation is something that is very important when you're giving a difficult news, especially like a breaking bad news or a news where like a medical error where the patient is going to get angry or or going to get emotional, right? That is where you always have to have an invitation. Invitation basically means you're preparing them for a news, right? It can be it's not a normal, it's not just a normal conversation that you're doing, consultation that you're doing. You're telling them that there is something rather important that you need to speak. So it's basically telling them to brace themselves, like in a way, right? So here just saying, I apologize for calling you unexpectedly. I'm afraid I have some important news regarding Haley's visit. So this is exactly what you did it too. Like you started off by saying, unfortunately there's something that I need to tell you. But you did that before you did any data gathering, because once you do your invitation, you don't have any more time at all. So they'll never let you ask any more questions. So always keep your invitation to be when you're ready to give the news, right? So always keep that in mind. So that is your invitation, and then your knowledge. So knowledge is basically you giving the entire. This is where your management will come in. That's where you're starting to deliver the actual news. So the news. So you explained the findings. You apologized. You talked about the complications, all these things. But always start with whatever has happened first. So you already spoke about it in the data gathering, but when you're actually giving the news, you just repeat the whole thing again. Very important. It's called a narrative. So narrative is something that's very important whenever you're giving a difficult news. It's either breaking bad news or medical error. You always have to give it in a narrative form, meaning you tell from the beginning what has happened again. So as you know that she was brought in to the hospital after swallowing a button, and you were told that it was normal, but the radiologist has seen the x-ray again, and they found that their button is there in the esophagus, which we missed. So you have to be very clear about the fact that there was a mistake, right? You did do that. I'm just reiterating it, but yeah, you have to do that in a narrative format. So which is where your management will come in. So your management starts, right?
So it's like layering. So it's like peeling an onion. So you know what you know as you know, like from the steps, and then you come to the point, where, you get to a point where they don't know what has happened after, a certain incident. So you are telling them till the point of their, visit to the hospital, taking the X-ray and the reporting of it being normal. But unfortunately, and then you start breaking the news like that. So that way, you're layering it. So you're like, are we on the same page? I'm telling you this because we discussed it, but we are on the same page. By actually layering the conversation that way, you can actually, get them to agree with you, like, be on the same page with you.
Okay.
Then, so the things that you missed in management is you have to explain what is going to happen next. So that is, you mentioned that we need to bring her in, but for what? You need to say it very specifically. I mean, I know that you were saying that we need to give her treatment, but what is it? You have to say that there's going to be a repeat X-ray to confirm that the button is, to see where the button is, and then decide the plan of action. That is basically either endoscopy or it's going to be a colonoscopy. Depends on where the button is, right?
So you did mention that, I kept asking you that where is the button, right? So you don't know that at this point. So that's exactly what you have to tell them. At this point, since it's been 2 days, we have to repeat the X-ray to find out where the button is. There is a chance that she may pass it if it's past her food pipe, and she may pass it normally in her stool. But just in case if it's not passed, we will have to take it out using invasive procedures. That way you're actually telling her this could be an extreme scenario or this could be a normal scenario according to the X-ray result. So do you understand that we have to do the X-ray and this is an emergency because of that, right? And if she says like, why is this an emergency? Then you can, after that, you can give her the complication saying that if it hasn't passed, there is a chance it may get stuck and that could cause her so and so problems: breathlessness, intestinal obstruction, vomiting, all that. So this is a button. So you're assuming that this won't be, it won't erode any of her structures. But what if this was a battery? Then you have to go in and take it out, right? So there is no chance of letting it pass because there is a chance that it might actually, leak. Right. So if you're thinking, so this is one of the scenarios that has come in the PLAB 2 exam of being a button. But what if they actually change the case and make it a battery? Then in that case, there is no letting it pass. Then you have to tell her that this is a chance that it may leak and we have to go in as soon as possible and take it out. So that scenario changes. So your emergency also changes. Right. So you need to understand what the situation and accordingly you have to explain it to them.
Okay.
Then, we spoke about knowledge. So knowledge is where you give the information, basically what has happened so far in a narrative format, and that's when the emotions will come in, right? So that's when the patient will start to get angry, and they will, or if it's breaking bad news, they'll start to break down, right? So this is where you have to process these emotions. So this is basically, there's a protocol called, there's a mnemonic for this. It's called EVE, Eve protocol. So that is, identify the emotion. That is emotion first. What is the emotion? And then V is validate. So that is, you always validate their emotion. So if they're getting angry, you say it. You have to be very specific. You have to mention that. It's in normal talking you might not do that, but in PLAB 2 you always have to, repeat back to them what they're showing, what emotion the simulator is showing, right? You should always say, I can see that you're angry and I can totally understand why you would be angry. That is validating. So you're basically saying that, yeah, you're getting angry and it's totally justifiable that you are angry. So that is validation. And empathize. So you have to say, I can totally understand why you would be angry, and I will do everything I can to rectify this. Okay, so that is your Eve protocol. That's something that you have to show. That's how you process the emotions. That's how you deal with the patient's emotions.
But what you did was absolutely, wonderful. You actually let me speak. That's one thing that, a lot of doctors don't allow the patient to do. You let me express myself. I was just saying whatever, however I felt at that moment. So that's very good. You have to let them speak. So if the simulator is trying to say something, let them speak, because at this point you're trying to appease them. You're trying to let them, vent out. so that you can, help, you can facilitate them to help you to rectify that situation, right?
Then, so
Yes.
next comes the strategy and summary. So this is where we have to talk about what is going to happen next. So first thing first, what is the main task of this station is basically you have to bring them in to the hospital. You have to tell them that you have to bring her into the hospital. So try to focus your entire efforts on that first, right? Because all these things about what is going to happen, who is going to see, and what treatment is going to happen, all these will come later. But the first thing first is you have to tell her that you have to bring her in as soon as possible right now, and she's going to fight you for that. She's going to say, oh, I can't do that, it's not possible. So instead of saying repeating the same thing that it's emergency, you have to bring in, you ask her why, and that's going to be an answer, right? That'll give you what the answer would be. So she will tell you why she can't bring her in. She'll tell you that she has work. So you solve that. You say that, okay, I'll give you a letter that you can show your employer, and you can say she'll say that there's nobody to take care of the other child. You can say that, okay, we'll help you with child care for your other children. We can arrange that as well. All right, and she'll say that, oh, I don't have a vehicle, I take the bus to go to work, and you can say we'll arrange a transportation, we can send an ambulance home, right? So all these things you'll only know the answer if you ask them what the actual problem is, right? That is something that's very important at this point, where for you to do your task, you have to tell them what it is first, and then if they refuse, if they say that they can't do it, you ask them why specifically. Instead of reiterating yourself, you always ask them what is preventing them from coming to the hospital. That's very important. So it's similar to where if a patient is refusing treatment, there are stations like that where the patient refuses treatment. It's the same strategy you have to use there as well, which is basically ask them why, and then you basically solve those problems one by one, right? So that's very important. And so the next thing is, yeah, so potential complications. So that is where, every doctor who takes our mocks, we always tell these three things that are very, very important. So that is safety netting, follow up, and leaflets and pamphlets. So every case, as soon as the 2-minute bell rings, so these three things have to be at the back of your head. So that is safety netting, follow up, and leaflets and pamphlets, because these three have like separate marks for themselves in management. So where if you don't cover these three things, you will definitely lose marks in management. So safety netting is basically think about what's the worst thing that can happen to the patient and just warn them about it. That's all.
Because at this point you don't have the patient in front of you, so something as dire as breathlessness and going into shock can happen in that time. So you have to warn the mother that just in case if you see these symptoms, make sure to call the ambulance immediately, because she might be arranging a vehicle to bring her child in, she might be arranging some relative to take care of the other child, so she might have to make some arrangement before coming to the hospital. But so there is a certain amount of time that will lapse before she comes to the hospital. So just in case in that time, if something happens, you have to warn her, if such a thing happens, what should you do, right?
Right? And leaflets and pamphlets are something. So in this case, you don't need to mention that. But if you have enough time, you should always bring that up as well. Say that. So here it basically works for emergencies. Usually it's not relevant, but for her social support, it's something that can be used as well. You can say that. So we'll give you information that you can use on how to prevent this from happening again, and you can say that how the incident report will be made, and what are the steps that we are going to take to prevent this from happening again. So that is something. These are all educational material. So that basically all that falls under leaflets and pamphlets, right? And next thing is follow up. So here main follow up is that you have to make sure that she is going to come. to the hospital, right? That's your follow-up in this case, which is basically you finally at the end of the case station, you need to know whether she is going to come right now or not. That's a follow-up. But if it's any other case, the patient is in front of you, so you always have to make sure that you set up another appointment with them so that they'll come back and see you again after a few weeks, because that's very important. Because if you send them somewhere, if you where either you refer them to another hospital, another clinic, or you discharge them home, whatever you do, you still have to see them again to find out what has actually happened from your treatment protocol, like what you have done for her. Whether it has helped her or not, you would only know if you set up a follow-up with them, right? So that's also very important. And other than that, your interpersonal skills are really good. You simple, clear language. You acknowledged and validated the emotions, provided reassurance, encouraged questions. And the only thing is, so this is the telephone etiquette, like you mentioned. Make sure that it's always important that you ask whether it's a good time to talk, whether she can hear you clearly, and if the phone gets cut, is this the number that we can get back to her at, right? I think we covered everything.
Yes, thank you, Dr. Mai, for joining us. And you are free to use the workbench. We have breaking bad news about 13 cases that are, that we can use for free, and you can practice your cases. And one thing that we keep encouraging doctors to do is just keep practicing the cases, because if you've encountered such a scenario, even if it's unknown, you will know how to react, right? And that's the main
Yes.
thing. In PLAB 2, there can be new cases altogether which you'll never encounter. So then what are you going to do? You have to learn how to react. So the main thing that they're trying to see is, if you are, recruited in the NHS, if on your first day, if you happen to encounter the situation, how would you react? Would you get flustered? Would you, cave? Or, you need to be very professional. You need to understand the protocols, and you need to, give them the right kind of treatment, and a holistic kind of treatment. And if suppose you don't understand the situation, or if it's difficult for you to manage it, how would you react to that? That also they want to see. So there would be situations where we completely new, out of the ordinary, where I happen to say that you're a junior doctor. What can you do? I want to talk to your senior. Give that option to them. If you get stuck, say that there are other people to help me. I'm just one of the doctors here. There are more doctors here who you might be more comfortable with. I can get you in touch with them, right? So everything that you can do in your power to help a patient out, right?
Okay.
So
Okay.
do go through our workbench.
Yeah,
We
and
also
there's also an AI patient that you can practice with. So there's a 1 week free trial that you can use. So we have put most of the modules for free for 1 week. You can practice how many ever times you want. So there's an AI patient I can just show you. So the same case that you saw right now. So you have a AI avatar that will basically simulate the case for you. So it's
Begin. Enter the room.
So this is where you can click on the microphone button here, and you can speak to the patient, to the simulator, and it will respond back to you.
And it also has a timer, so you can actually see that you are able to do the consultation within 8 minutes, right?
Okay. Looks fancy.
Yeah, so this is something that helps a lot. Most of the doctors who've used this had like such a big advantage, because they have a lot of practice by just just doing this. You can just sit at home and do this. You don't even need to find a practice partner anymore.
And after every consultation, you will get a checklist like the one that we just showed you, saying how many points you covered in data gathering, management, and interpersonal skills, and how you can actually improve it. So definitely do try it out, and good luck for your exam. I know it's a very it's a very daunting exam, and this is a very crucial step in your PLAB journey.
Just like, will I like still pass this station even if I didn't do like a lot of data gathering, or like how many marks
So you need to understand this thing about the data gathering of how the marking is. So there is 4 marks that will be for management, 4 marks for data gathering, and 4 marks for interpersonal skills, right? So if you haven't done data gathering, so you can understand that you're losing those 4 marks, right? So it will
Yes.
be only how much management and how much interpersonal skills you have done to salvage that station.
So I think you scored 7 out of 12 in this station. So which is an easy pass, but don't keep that as a standard. So always try to, because it's completely subjective. So where if the examiner felt that you didn't do enough data gathering, they might reduce the marks for management also, even if you did cover everything. So because it's in their hands ultimately. So always make sure you do everything properly. Don't never only focus on one thing, right? Always try to cover all 3 aspects. But yeah, you did really well considering this is your first mock. But yeah, all the best.
All the best, Dr. Mine. And
With
thank
the
you.
detailed feedback.
Absolutely. You're free to book another mock with us. We have some of the options for the paid mock as well. And you can see some of the pricing plans. And if you would like to take another mock, we would be happy to accommodate you.
Yeah, and if you take the paid mocks, you get access to both the AI patient and the OSCE workbench for free till your exam date as well.
Okay. Thank you very much. I'll definitely consider it. I really enjoyed the detailed feedback and I feel like I benefited a lot.
Nice,
We're
we're
Thank you so
glad. Thank
much.
you. All right, thank you,
Thank
Dr.
you.
Hasib and Dr. Mela. Thank you for joining
Thank
too.
you for joining. See you again next week, everybody. All right.
Bye.
Bye-bye.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.